It is my pleasure to introduce the FYE 100 Inquiry Paper Award finalists, who will be presenting their papers as part of the McMaster Symposium and Academic Colloquium. Each FYE 100 faculty member submitted what they considered the best inquiry papers in each of their sections, and then Defiance College faculty outside of the FYE program completed a blind reading of the submitted essays to evaluate and then identify and rank the 5 finalists. The award is then given to the top student among the 5 for their outstanding inquiry research paper. The word inquiry means to ask for information. This idea of asking effective questions and learning to locate, evaluate, and synthesize information is at the heart of the FYE 100 College Engagement Seminar course. In college, we want you to learn to create and produce knowledge, not just memorize and report it. We also want students to recognize that scholarship or academic research is a conversation or an academic discourse. As a student, you are jumping into a conversation with your research, with your authors, so that you can gain new understanding of your research topic. The 5 finalists who will be presenting their inquiry papers are Logan Gray, Emily Vargo, Kayla Betker, Tyrell Goings, and Haley Webb.
My older sister, Harley, always pushes me to be a better person because she finds herself in trouble a lot, and I feel as if it is my job to help her get out of it. However, when she met Matt at a bar, her entire life changed because he brought her into an abusive relationship, both physically and emotionally. I could never find the right things to say to convince her to leave. I talked with my parents, my therapist, and my friends to get ideas to see how I could try and help my sister leave the abusive relationship. From the very beginning, around 3 years ago, I knew things were not going to end well between my sister and Matt. Within 2 months of them dating, I got a call from my sister saying she was pregnant. She moved back in with our family because Matt threatened her and her baby Landon with a gun one night while drunk. For my family and other families to support young women in abusive relationships, background information about what women go through emotionally and physically is essential. According to the Journal of Family Psychology, women can suffer severe and sometimes deadly injuries from intimate partner aggression, IPA. IPA is violence performed by a spouse or former spouse in a relationship. It can take various forms, including emotional, physical, and sexual abuse. Physical injuries and depression are the most common effects. An increased level of stress can be apparent when women are actively living with their abuser. Knowing this information can help families understand what their loved ones are going through and the effects an abusive relationship has on them. For me, this information would have been useful to know when my sister moved back in because she would not have had to feel the pressure to explain herself or her feelings on that specific night. When my sister arrived at our house, the police officer walked her up to the door, and they were talking about restraining orders. At the time, I still didn't know what was going on. After my brother and I finished bringing everything inside, and the baby was back asleep, my sister sat us down and told us the story of what happened and how she felt emotionally. My sister struggles with her mental health, so the stress of this night caused even more stress than she needed and could handle independently. If I had understood IPA and its effect on women who experience it, I could have supported my sister differently rather than her feeling obligated to give my brother and me an explanation for how she felt throughout the relationship. Family members need to understand what the victim is going through before the healing process can start. Sadly, while my sister stayed at our house for a year and a half, she continued to see Matt and continuously put her son and herself in danger. Not only when she put her son's life in danger, but she also put herself in the position to get degraded and brought down daily. I will never fully understand how a person can say they love someone, but then purposely put them down and abuse them, but I can try to understand. I believe it is essential to understand both sides of an abusive relationship to fully support the person being abused, in my case, my sister. It is important because it could allow the family members to explain why the abuse is taking place and give the victim an explanation. A study by Perveen Azman Ali and Paul B. Naylor provided information about different reasons for why domestic violence can occur. They looked at various situations such as the biological perspective, neurotransmitters, psychological perspectives, and alcohol and substance abuse. The biological perspective, more specifically neurotransmitters, deals with testosterone and its relationship to aggressive behavior, leading to abuse in a relationship. In male prisoners who have had a history of violence against their wives have higher testosterone levels. Furthermore, high testosterone levels have shown a high association with physical and verbal abuse. This could show young women that their actions are not why they experienced the abuse. However, we can also look at psychological perspective, specifically alcohol and substance abuse, to get more options for why someone may start abusing. Research shows that males and husbands who have alcohol problems are more likely to abuse their wives and partners than those who do not. It also shows that it will occur more frequently and severely than non-alcoholic men who abuse. Knowing this can help me support my sister because Matt has a drinking problem and has acted violently towards her when he was drunk. I can help give my sister information and facts to prove that the abuse will follow as long as he continues to drink. Now that we have looked into both sides of the abused and the abuser, it is important to understand the importance of family members' reactions when someone they care about tells them about the abuse. A study conducted by Jessica Goodkind from California State University and T.L. Gilman, D.I. Bailey, and C.M. Civilian from Michigan State University showed the importance of supportive versus non-supportive reactions from family, friends, members. The women who participated in the study were more likely to receive emotional support from their friends or family when they spoke up about the abuse. Their supporters would support them positively by providing them resources to get the help they needed. At the end of the study, they concluded that family and friends' reactions play a significant role in impacting the woman's overall well-being and the type of help they received. If a woman had left and gone back to their abuser multiple times, the family's reaction would be more negative. The response is negative because the family members could be tired of the loved ones going back into a dangerous environment and feeling hopeless. These negative reactions resulted in a low quality of life because leaving the cycle of abuse takes time and support, so there is no support during a critical time. However, if women had children, their family members' reaction was more likely to be positive and supportive. This reaction could be because the child is the primary concern and the family does not want them to be in danger. However, many factors play a part in how family and friends react and how they show their support. When my sister moved back in and continued to see Matt, my mother and I talked about the possibility of kicking her out, but we always ended the conversation with the importance of keeping Landon safe. Telling family and friends about abuse can be worrisome because they never know whether they will get a supportive or unsupportive response. According to the Journal of Family Violence, supportive persons were able to find resources and networks for women. Having family and friends as a support system can be extremely beneficial because the abused women can rely on someone they trust. Someone supportive provides informational, emotional, and physical support, helping them find enough resources and networks to leave the abusive relationship. A good support system is needed for a woman to recover from or leave the abuser. The study also showed that the persons who did not support the women had a significant impact on them. Unsupportive persons ultimately made the women continue to stay in an abusive relationship because they were blamed and judged for their situation. My family tried to be as supportive as possible with my sister while still trying to help her understand all of the terrible and toxic things happening in her relationship. Lastly, family and friends need to find resources they can give to their loved ones. There are many different types of therapies and community resources to help someone who has gone through abuse. For example, from the Oxford Handbook of Music Therapy, music therapists that work with domestic violence survivors are a growing practice in today's society. Women who have experienced any type of abuse can use music to empower them. Feminist music is a great example of a kind of music that can empower women when they feel helpless and degraded by men. The music includes an analysis of gender and power and the value of a woman's perspective. Not only listening to music can help, but also analyzing the lyrics, writing lyrics, and singing along to it. I found this type of therapy interesting because Landon loves listening and dancing to music, so my sister could have a chance to bond with him while feeling empowered and important. As a family, we continue to support her by having a judgment-free zone, listening, and dancing to music. How can family members support young women from abusive relationships? How can my family and I help support my sister, who is a single parent from an abusive relationship? A family needs to understand what women go through and get a sense of how they feel. They need to understand the woman's side and the abuser's side to explain why the abuse could be occurring. Families need to try their best to be positive and supportive, because without the support, the abuser will win. There are so many different types of resources and connections that can help. If one resource or therapy does not work, there are many others to try. And it could even serve as a bonding moment for families. Family members can help support their loved ones from abusive relationships by understanding, supporting, and trying new therapies together.
In my autoethnography, I wrote about my ear issues and what it was like growing up hearing impaired and all the struggles that came with it. This led me to ask the question, how does hearing impairment affect childhood development? I looked at 5 different articles that describe the effects of hearing impairment in childhood development. I did this because it would help me answer my research question. My articles consist of studying hearing impairment in children while doing ordinary tasks in and out of school to see if there was a development delay compared to children who had perfect hearing. With only using 5 articles, there is a limitation. There are so many studies out there, but there is so little at the same time. It's really hard to tell if there is really a delay in development or if it's just harder for those who are hearing impaired. It is also really difficult to tell if hearing impairment causes delay when some studies who look at other factors and not just hearing impairment in itself. In my autoethnography, I wrote a lot about my ear issues and all the struggles that came with being hearing impaired. When I was 2 years old, I had tubes put in my ear. By the time I was 4, the tubes fell out and the tubes still hadn't fallen out yet. One day, I had a really horrible ear infection and it blew the tube out of my ear, which ripped a hole in my right eardrum. Usually, when an eardrum blows, it will repair itself, but mine didn't. Instead of healing, the hole grew. When I was 6, I had my first ear surgery to repair my eardrum. The eardrum lasted about 9 months until the hole started to grow again. When I was 9, I had another surgery to repair my eardrum. This time, the eardrum only lasted for 6 months until the hole started to grow again. When I was 12, I had a surgery to get a Baha implant so I could hear by bone conduction instead of air conduction. Hearing aids were not working anymore, so the Baha was my only option. When I was 16, I had another ear surgery to get an eardrum. By this point, I had 500 ear infections in only 2 of the 3 bones in my ear. I was constantly sick since bacteria was always getting into my system, since there was no eardrum to stop the bacteria from entering my body. After 7 months, a hole started to grow in my eardrum again. When I was 17, I had another surgery to repair my eardrum, and that eardrum is still holding up today. With this struggle, it made school very challenging. Not being able to hear my teachers or classmates properly made life very difficult and caused me to be behind my peers for a long time. Over time, I learned how to overcome this challenge and eventually caught up to the same learning ability as my classmates. In the first study I looked at called The Impact of Hearing Loss on Children's Development in Family Constellation by Laurie S. Eisenberg, began with enrollment in cochlear implantation in 2002 to 2004. They screened children under 5 that could qualify for cochlear implantation. 425 children were screened. Out of the 425, 268 children met criteria. 80 families decided not to participate, which led to a total of 188 children enrolled. In the study, they compared children with cochlear implants to those with typical hearing in areas such as spoken language, speech production, auditory performance, and psychological functioning. Results showed at age 3, those who received implants sooner showed a very positive change in development compared to those who received implants later on. However, there was a gap between children with cochlear implantation to those with typical hearing, especially when children received implants later on in life. Results showed that 4 to 6-year-old children with cochlear implantation had a positive result in language and sentence recognition. Then, by age 8, the results showed that children who received cochlear implants were on par with those with typical hearing. They also noticed that a small portion of participants relied on sign language. Those who relied on sign language were more behind on development and couldn't reach milestones that children with cochlear implants could. The second article I looked at was called Language Development and Impairment in Children with Mild to Moderate Sensational Hearing Loss by Lauren F. Holliday, O.T. Tusami, and Stuart Rosen. This article examined language development and factors related to language impairment in children with mild to moderate sensorineural hearing loss. In this study, there was 2 groups that were ages 8 to 16. One group had mild to moderate hearing loss, while the other group had typical development. In this study, they tested each group in reading and language ability. The results show that mild to moderate sensorineural hearing loss groups was lower than the typical development. Even though the first group was in normal levels, they were extremely low to the second group. The third article that I looked at was called The Relative Contributions of Speech Reading and Vocabulary to Deaf and Hearing Children's Reading Ability by Fiona Elizabeth Kyle, Ruth Campbell, and Mariad McSweeney. The article was really close to the second one. The study starts off stating, despite having intelligence scores in normal range, the majority of deaf children have poorer reading outcomes than their hearing peers. Large-scale studies report that deaf school learners have reading ages far behind their chronological ages, and reading skills seem to develop at only a third of the rate of hearing children. In this study, there were 86 deaf children ranging in ages 5 to 14 and 91 hearing children ages 5 to 14 who took part in the study. The study had then complete 4 tasks to assess reading ability, speech reading skills, excessive vocabulary, and nonverbal intelligence. The results showed that hearing children scored age appropriate for reading accuracy and reading comprehension. The deaf children scored an average reading delay of 16 months in reading accuracy and 22 months in reading comprehension. In vocabulary, the hearing children scored significantly higher than the deaf children. However, when it came to speech reading skills and nonverbal intelligence, there was little to no difference between the 2 group scores. The fourth resource that I looked at was an article that was called Factors Affecting Psychological and Motor Development in 3-year-old Children Who Are Deaf or Hard of Hearing by Greg Hellea. This study looked at factors affecting psychological and motor development in 3-year-old children who are deaf or hard of hearing. 301 hearing impaired children participated in the study. All but one child used some sort of hearing device. During the study, they had the children answer standardized questions that were designed to assist the child's development. The results showed that psychological and motor measures were average and that language outcomes were slightly below average of typical development. The last study I looked at was called The Effects of Theory of Mind Training on the False Belief Understanding of Deaf and Hard of Hearing Students in Pre-Kindergarten and Kindergarten by Stacy L. Tucci, Sansa R. Ettersbrook, and Amy R. Letterberg. This study was shown to see if children with hearing loss are delayed in theory of mind development compared to those with typical hearing. The study was done in 4 different kindergarten classrooms with a total of 14 participants. The child had to choose a series of options. If they chose correctly, they would score points. In the study, the results state 13 pre-K and kindergarten deaf children across 4 classrooms who used various communication modalities participated in 15 to 18-week TOM intervention. Intervention was conducted and data were gathered following published and accepted standards of rigors for SCD. Results from the study support the assertion that deaf children in pre-K and kindergarten, regardless of communication modality or placement, can improve their false belief understanding following of TOM thought bubble intervention and can generalize their understanding and parallel task. In my research, I looked at 5 different articles that describe the effects of hearing impairment in child development. The articles consisted of children answering standardized questions or doing ordinary tasks in and out of classroom to see if hearing impairment causes any developmental delays. By looking at all of my sources, it is certain that hearing impairment does cause delay in development compared to those with typical hearing. In some cases, it looks like there wasn't a huge difference in some studies, but there was indeed a difference. There was also evidence that showed those who receive implants or hearing devices sooner than others develop at a faster and more positive rate, which does answer the question that hearing impairment does affect childhood development. Looking at the studies was very difficult. Even though there are articles studying the effects of hearing impairment on childhood development, there is not a whole lot of information about this topic. While studying this, there did seem some gaps in some research. Either some things were not studied all the way, or they just talked about other studies and not actually doing the particular research themselves. Many of these studies looked at other factors and not just hearing impairment, which became frustrating at times. It made it much more difficult trying to figure out what delays hearing impairment causes when you are adding other factors into the equation. In the future, if I decide to pursue this topic more, I would be interested in seeing if there is delays in all kinds of child development caused by hearing impairment. I would also like to see what kind of delays are more noticeable during the lack of hearing and what can be done to improve development. I would like to do a study where I take a group of children with and without hearing impairment from infancy to teenage years and study their development to see what development delays they have. I would have them participate in different surveys, tests, and activities that show learning development. Then I would also like to have a group where I can focus on ways to help improve development and see what strategies work best and can provide the best outcomes on a child's life.
When I was younger, I would always flail my arms and twitch my shoulders constantly and result to having Tourette Syndrome. Children always laugh at me because of my tics. The older I became, the more types of tics I developed. Now, I squint my eyes frequently, roll my top lip into my mouth. I still shrug my shoulders and now clench my entire body. Sadly, these tics will stick with me for the rest of my life. Tourette Syndrome typically occurs during childhood years, but will remain for the rest of your life. According to recent studies and tests done within this research, it is shown that typically, Tourette's will form between the ages of 10 to 17. To coincide with these findings, experts have expressed that estimates of TS ranges from 1 to 10 per 1,000 in children and adolescent population. Through more analysis of TS and finding out the causes to this syndrome, we have also figured out that, consequently, there is a high comorbidity rate between TS and other psychiatric disorders, including ADHD and OCD. Experts have studied Tourette's, and evidence shows youth with TS are rated by peers less positively. When my Tourette's were at its worst, my second home was the hospital room because they would constantly run tests on me to see why it was occurring so often. Not only did Tourette's impact your daily life, conducted a research analysis of 200 cases where they concluded that 36% of the children has some degree of academic difficulty and results to Tourette's. Throughout this inquiry paper, I want to discuss the diverse topics that coincide with the impact of Tourette's in children. These topics include the impact of family relationships, peer victimization, quality of life, and tick severity. We were heading back from my doctor's appointment in Fort Wayne. My Tourette's had been excruciatingly bad this week, resulting in muscle tensions in my neck and back, and I tried to control them, but I had no luck. My father started to yell at me because he thought I was doing it on purpose. He yelled at me that entire way home from Fort Wayne to Payne, which is a 30-minute drive. That day would not be the last I would get yelled at for something I could not control. Some may not understand, but dealing with TS or Tourette Syndrome, a strong family relationship is critical. Researchers in this field had expressed that effects on family relationships can include high caregiver strain and stress. Furthermore, due to a higher than usual comorbidity rate, people with TS and the family often report impairments in daily functioning. During my sophomore year of high school, I was shooting a free throw in our third basketball game of the year. I ticked while I was shooting my free throw. After the game, people came up to me and started laughing because they thought what I did when I was shooting was funny. I always try to avoid conversations like these because I do not like feeling of the laughingstock of the conversation. I never speak of my Tourette's because situations like these continue to happen even after you grow up. From experience, it is evident that children do not like talking about their TS because of the backlash they may receive from their peers. Experts have expressed that children with tics may be at greater risk rather than a person who does not have tics and be bullied due to the presence of tics could either be stigmatizing or misunderstood. In the same sense, Stokes expressed in research studies that in some reports, peers and teachers considered children with TS as less popular and more withdrawn than the rest of their age group and gender. Growing up, I always thought of myself as an outcast because I was different than the others around me. They never understood what it was like to have Tourette's. I was in a very depressed state throughout my entire childhood. I was on medication for my tics, and the medication made me even more depressed. I never wanted to leave the house just to save myself from the embarrassment of going out and getting made fun of. A child's quality of life can be catastrophic due to TS, and they may never be able to bounce back from that stress, emotional trauma, and physical harm that Tourette's could cause. For instance, researchers discovered that youth with TD demonstrate difficulties with social deficits while also struggles of psychological and emotional traumas. To go along with the quality of life of these individuals with TS, higher tic severity is generally associated with general quality of life. One night when I was the age of 12, I was playing Xbox at my house like I normally do. I got excited throughout my game and noticed how much I was ticking. It became so much that whenever I did tick, it would hurt. It started to physically harm my body because my muscles were so tired of tensing up and doing the same movements repeatedly. That day, I cried for a while because I just did not understand why I had to be born with Tourette's. This was my worst day of Tourette's, but they never got easier to handle. They were always super difficult for me to control or even live with. Tic severity can vary throughout person to person. Some individuals may have more severe tics that could be damaging to their body than others. Many variables can attribute to this factor occurring. For example, researchers have discovered in some studies that global tic severity can be linked to increased academic difficulties. In the same sense, tic severity can be positively related to peer victimization. Tic severity can also be attributed to heightened family conflict as well. As you can see, it is a connecting circle on this whole topic. Tic severity will vary depending on how well your quality of life is. It can also depend on how your peers treat you and what type of person they see you as, whether than being a normal human or someone as an outcast. Also, tic severity can be based on your family relationships and how they treat you at home. They can either appreciate your differences and help you throughout your journey with Tourette's, or they can treat you as a nuisance and be bothered by them. I found that throughout life, you'll be criticized for the things that you do. You will not have the friends you believe you have, nor will you have the family support you think you will. People will laugh and taunt you for not being like them. Family will argue over whose turn it is to take you to the doctor, because neither of them want to take you because they are tired of going to the same place 4 times a week. You will also get very tired. You will not want to do anything but sleep because your Tourette's were so bad that week that you are too sore to move. What I found to help motivate me throughout this process was there will always be those friends and family who genuinely care and will support you no matter what the outcome. Those are the only opinions that matter, and you should not listen to anyone else's opinions but those who care. As discussed throughout this entire paper, we talked about the various impacts of Tourette syndrome in youth, such as family relationships, peer victimization, quality of life, and tic severity. I wanted to cover this topic for the sole fact that I know firsthand what this syndrome does to you, and know it can affect your life in many ways. I grew up with Tourette's, so I wanted to know more in depth on what impact it had. For future research on this topic, I believe that they should continue the research they are doing now. The one thing I would do different is I would try to hold research studies with more children with Tourette's so that it would further help back up the evidence in the impact of Tourette syndrome in youth.
How do academics affect anxiety, and how does anxiety affect students? After showering one school night in November, I began to make my bed to calm down despite knowing I would tear it up again within the hour. As I was tucking my comforter under my pillows, I noticed a bunch of small brown stars on my white sheets. Alarmed, I retrieved my mom. Everything blurred except the sight of my bed moved out from the wall, the smell of rubbing alcohol, and the sound of the vacuum. As my mom was frantically putting my things in black trash bags, I was ordered to take another shower, but I had to wear my mom's pajamas, as mine were probably crawling with bed bugs, as she would put it. I found myself sleeping in the spare room on an air mattress that night, exhausted from school, from science fair, from finding out my itchy arms and legs were not simple reminders of the summer, but rather a bedbug infestation. I had a partial job taking care of my grandma's apartment for her. It was at one of these cleanings where I noticed the same brown stars from my bed sheets on her chair. We found bed bugs crawling all over that 3-bedroom apartment. She can't stay here. She will have to come live with us for a little while. My mom was just as stressed as I was. She was working 80 hours a week with a boss who had no sympathy. So my grandma moved to our living room couch. I was still sleeping in the spare room on a leaky air mattress. The things piled on the tables next to me were literally falling on me in my sleep. My personal and academic lives had piled up to the point of suffocation. My science project, my struggling Algebra 2 grade, staying in shape for soccer, and learning to drive. My anxiety was compounding. I had yet to say a word to my friends. It was only the first week of December. Multiple sources have confirmed that when students are overstressed, their academic performance declines and their mental health begins to slip. In their essay on students with anxiety, Miradali, Morrissey, and Ball include information about the effects anxiety can have on students' performances by paraphrasing Landau, saying that students with anxiety have a difficulty with attention issues, which negatively affects learning, reading, writing, and memorizing. Students have also been observed to develop health problems such as eating disorders and sleep issues when faced with anxiety. Students with higher trait emotional intelligence levels tend to be more resilient to academic anxiety, but those with lower trait emotional intelligence are less resilient to anxiety, which leads to academic burnout and, in extreme cases, high school dropout. The effect of academic anxiety can cause students to develop physical health issues, lower their academic performance, and even lead to academic burnout. Anxiety from academics can cause students to mismanage stress, resulting in poor sleep quality, which furthers the body's stress mismanagement. In their study, Zhang, Yan, Shum, and Deng explained the body's stress responses by citing Compass and others as either voluntary or involuntary. Voluntary stress response includes coping mechanism and emotional regulation, while involuntary responses are typically the fight or flight response. When the body is sleep deprived, the involuntary response takes over, which results in emotional problems. Yi, Posado, and Liu say that poor sleep quality disturbs an adolescent's reactions to academic stress, which then increases depression and anxiety symptoms. Stress and sleep deprivation can actually lead to depression and anxiety. School the next morning was exhausting. The reminder of why I was so sleepy made my brain fog worse, and there was no way I could tell my friends about this. They would never want to hang out with me again. So I kept the situation to myself and my family. That first poor night of sleep was by far not the last. The buildup of stress, paranoia, isolation, and schoolwork became overwhelming for me, which must have all played into the anxiety I developed for my schoolwork. Academic anxiety can play into the stressors that cause eating disorders for high-achieving students. In their study, Dr. Krafchek and Dr. Kronberg from Monash University compared the testimonies of 14 high-achieving females with disordered eating to identify the possible stressors of their lives. Krafchek and Kronberg state that all 14 of their participants cite stressful events stemming from academics in their interviews before they developed eating disorders. These stressful school-related issues generally stemmed from the pressure these participants put upon themselves. One student claimed her perception of failure made her more stressed when she achieved a B+ on her math test. When I received a B on my semester exam for Algebra 2, I too felt like I had failed the class, failed my parents, and most tragically, failed myself. The hours of studying paid off, except for Algebra 2. I did well, but not up to my standards. It was a 2-part exam, half with multiple choice, the other half was free response. I got a low A on the multiple choice and a C on the free response section, which averaged to the only B on my entire high school transcript. I cried. It was late. Most of the house was asleep. I cried into my sweatshirt sleeve, my arms tightening around my neck as I desperately tried to be quiet. But I worked so hard, harder than anybody else in that class. How did I end up with a C on the free response? I cried until I could not breathe anymore. It was okay. I didn't want to. Fortunately, I did not develop an eating disorder during these trying months, but by overlooking the fact that other high-achieving females cite the academic stress in their lives as significant contributions to the development of their eating disorders, we completely ignore the severity of the effects academic anxiety has on both mental and physical health. Students facing academic anxiety typically perform worse than their unanxious peers. In their study on pharmacy undergraduate students, Miradali and others concluded that test anxiety, academic competence, time management, and strategic studying are all factors that significantly affect academic performance. Students that had more test anxiety had lower grade point averages, while students who understood the material, had adequate time management skills, and had better studying methods achieved higher grade point averages. I began studying for my Algebra 2 exam 3 weeks in advance. I ended up doing every single problem in my textbook for every chapter we covered. I studied 39 hours for Algebra 2 alone, not to mention all the studying I did for my other 4 exams. I studied at the dining room table, listening to Star Wars soundtracks to drown out the TV blaring from my partially deaf grandma, my dad cooking dinner, the dogs barking, and the other distractions of our household. Although I did everything math teachers recommended for studying, I didn't cram or procrastinate the studying, and I did not skim my notes, I still only received a B, perhaps because my test anxiety was so high. Students who have trait emotional intelligence typically display higher levels of resilience and lower levels of academic anxiety than their low trait emotionally intelligent peers, of whom tend to burn out quicker. Fiorelli, Farina, Buonamo, Costa, Romano, Larkin, and Petrides cite a report by Petrides, Pita, and Kakinaki defining trait emotional intelligence as a set of emotion-related personality dispositions concerning how people manage emotions and understand the impact of their emotions or social interactions. Their study used resilience and academic anxiety as modifiers on whether or not students would burn out. Fiorelli and others found that students with higher trait emotional intelligence held more resilient mindsets, which in turn helped them handle academic stress, resulting in lower academic anxiety and lower chances of academic burnout. On the flip side, students with lower trait emotional intelligence were less resilient to stressors, which caused them to have more anxiety and a higher chance of burning out. I approached the second semester more resilient than the first, perhaps because I experienced a failure and learned that it wasn't so bad. I did well at both local and district science fairs and was the only student from my school to attend the state science fair at The Ohio State University, where I did not advance to regionals. Finals in the spring are never as bad as winter finals, probably because there's sunshine and the temperature is warm. I did well on all of my exams, this time including Algebra 2. My success felt long overdue as it blossomed in late May. Between science fair success, my satisfactory final exam scores, getting my driver's license, and getting to attend a youth summit, things felt like they were finally looking up. I began attending therapy sessions for my anxiety halfway through my junior year of high school, which helped me develop the coping mechanisms and mindset I needed to deal with my anxiety. Anxiety can cause students to lose sleep, which in turn worsens anxiety. Some students even develop eating disorders in response to academic and personal stressors. Increased academic anxiety leads to worse academic performance. However, students with high trait emotional intelligence tend to have lower anxiety levels than their resilience than their trait emotionally unintelligent peers, of whom are at risk of dropout and burnout. The role stress plays in anxiety piqued my interest as I self-reflected on the many different stressors that played into my anxiety during my sophomore year. Stress and anxiety ultimately inhibit performance in academics. More research must be done on trait emotional intelligence, mindsets, and voluntary stress management to prevent an entire generation from buckling under the pressure of daily life and the uncertainty that the future brings.
Overuse, break, restart. I still was so confused at what was happening. I knew something was wrong, but I simply thought my leg was bent straight into the air as I felt a constant throbbing pain in my leg. I remember seeing the icy stare of helplessness as one of the EMTs told my father there was no pulse in my foot, and without the resetting of my leg on the floor immediately, I risked the loss and damage of my lower right leg. Despite the many benefits of incorporating athletics in one's life, more and more youth athletes today are facing the negative pressures and consequences of athletic participation, including overuse injuries. According to the article, Overuse Injuries in Pediatric Athletes by Drs. Ryan Reidendor and William Henriques, overuse injuries are anything related to repetitive stress applied to the musculoskeletal system without adequate time provided for recovery following the stress. Sports are a huge part of the American culture, but this puts youth athletes at greater vulnerability of suffering an overuse injury due to their immature skeletal system. I was a prime example of that at-risk youth athlete who was willing to give it all to be successful in athletics, but soon suffered and faced the consequences of pushing my body to the limit year-round. Increasing overuse injuries among youth athletes are caused by an overall increased participation in athletics, training year-round, and sports specification. I've always had grit, or at least in my mind that drive to be successful and the best version of myself in every aspect of my life, from my education to my athletics. Growing up watching my parents, I was taught the value of hard work ethic and persevering in order to accomplish your goals in life, and this transcended directly to my athletics. After my junior year high years, I became totally driven to transforming my body into the ideal athlete by eating in a way that I thought was healthy and running mile after mile every day. This idea worked for a little while, but I had no idea the implications and pressures I was putting on my body and the consequences of it later. One of the main causes of an increase in overuse injuries among youth athletes is the overall increase in athletic participation nationwide. It is no secret today that sports are a huge part of the American culture, and many youth athletes feel the pressure to succeed and participate in sports from many outside sources. In the United States alone, roughly 60 million children take part in organized athletics, and over 50% of these children participate in more than one. Where there is an increase in participation of athletic activity, there is also an increased risk for overuse injuries, as more and more children are spending more of their time being active. According to the American Academy of Physical Medicine and Rehabilitation, the widening gap between children who are overactive versus children who are inactive undoubtedly affects this as well when children who are formerly not as active suddenly take on the athletic pressures of today. An overall increase in athletics among youth today is no doubt a reason for these increase in overuse injuries. By the time the summer before my junior year came, I was spent, but I continued to run. I didn't miss a single open gym, game, or workout. I spent the whole summer basically in the gym. I would spend a few days resting, but never enough, of course, because we were in closing on season, and soon I would be fighting for a position on my basketball team. I kept pushing my pain away because that was the tough thing to do. In addition to an increase in overall participation in athletics, another cause of overuse injuries is year-round training among athletes. More and more youth athletes are training year-round for the sports or sport they participate in, therefore giving these athletes very little time for their bodies to heal and muscles to repair themselves. Since overuse injuries occur from repeated stress to parts of the body without adequate time given for the body to rest and repair, it can be shown that year-round training is harmful and can lead to these injuries. In fact, in a study done with high school athletes nationwide, it showed that athletes who train for athletics year-round had a 42% higher risk of having an overuse injury compared to athletes who take at least one season off. The longer and more constant the athletic training is, the more the body is put at risk as well. The increase in the amount of athletes that participate in year-round training is certainly a factor in the increase of overuse injuries among youth athletes. I found myself in a really unhealthy lifestyle of repetitive cycle, but I was doing something I once loved to do. So I thought to myself, you can't give in now. I was dedicated to being the best athlete I could be, and in my mind that would take superior endurance. I began running day after day, mile after mile, no matter how much it hurt. I was getting stronger, or so I thought I was. Sport specification among youth athletes is another major cause of the increase in overuse injuries in youth athletics. Sport specification can be defined as the intense training in one sport at the exclusion of other sports, and often results in overuse injuries due to the repetitive motions the athletes perform. According to the Journal of Legal Aspects of Sport, not only is sport specification at an early age believed to be unnecessary in achieving later success, but also puts athletes at risk for increased injuries, psychological stress, and dropout from sports. Running mile after mile or repeating the same motion over and over wears down and weakens the targeted muscle or bone, and without rest, this can result in a serious overuse injury. According to the journal Sports Medicine, repetition is the main reason why sport specification puts athletes at such an increased risk for injury. And sports that contain lots of running, jumping, and landing increase the risk of lower extremity overuse injuries. Overuse injuries can undoubtedly be a result of sports specification among athletes. The doctor, after examining the x-rays, finally explained to me the news. I would undergo immediate surgery in the morning to place a rod in my leg. I had completely snapped both my fibula and tibia in my right leg. After he left the room, I finally bawled, mostly because I was afraid. However, by the faithfulness of God, my surgery was successful, and today I have 3 scars, an indentation, and a permanent metal rod from my knee to my ankle to remind me of it. The breaking of both my fibula and tibia were a prime example of how overuse injuries are caused by an overall increased participation in athletics, training year-round, and sport specification among athletes. Overuse injuries among youth athletes are on the rise, so this means there are many athletes, once like myself, parents and coaches who mistakenly overlook these causes of overuse injuries until it's too late. This is very concerning for the well-being of youth athletes everywhere, because even though I was able to learn and grow from my tragic injury, not every youth athlete is that fortunate. In addition to my concern for youth athletes everywhere, it was interesting to discover that lower extremity injuries, including my specific overuse injury and the breaking of my right leg, accounts for about 47 to 54% of all sports injuries. Even though overuse injuries can have lifelong consequences, especially to youth who can damage the growth processes through these injuries, overuse injuries are almost entirely preventable if detected and proper time for rest is given. Although there are many lessons to be learned and ways to grow by experiencing an overuse injury, we all as athletes, coaches, and parents could do a better job of detecting and being educated about the signs and unhealthy habits of overuse injuries among youth athletes. I believe the first step in relieving some of this pressure of extreme athletics from our culture on youth athletes, so that less athletes like myself have to continue the cycle of overuse, break, and restart. Looking back and through all the thinking I did, I wouldn't change a thing or trade my memories in athletics for anything in the world. Of course, I never wanted my body to undergo such a major injury, but it actually taught me so much and partly freed me from a harmful cycle of damage I've been doing to my body. It's very difficult to admit, but it gave me a way out and a reason to say no when in the past I hadn't been able to due to the fears of disappointing the people I looked up to. I continue to keep my grit today, as each day I make a conscientious choice to be the best version of myself that is also the best to my body. I still struggle with it every day, but I'm getting better. I truly believe God uses the bad experience meant for evil in your life for good if you let Him. And sometimes you really need a clean break for a fresh start.